really kind of go in now into the basics of what an implant is. Of course, it's made out of titanium. Everybody in this room knows that it's made out of titanium, which is very unique. They tried many different substances over the centuries with implants, but it wasn't until this titanium device was found accidentally by Dr. Brannemark that it gave rise to the whole world of implantology. So titanium is really the key, because it's lightweight and it's surrounded, it's soft and it's non-corroding, meaning that it forms almost like a ceramic forms when it's exposed to oxygen and forms to the environment. And that was what's unique about the titanium. And, of course, implants have threads around them. And the threading, what that helps, it helps engage the bone and helps increase the surface area. So that is what's unique about the design of the implant. Titanium, and it's a threaded screw. But, you know, before they came to the design of the threaded screw, they went through a million different designs. Has anybody seen blade implants like this? A lot of the room. Doesn't it look like something, you know, from Mars? You know, it's hard to believe. You know how those were put in? They would take a high-speed handpiece and they would cut a slot in the bone back and forth. And then they would put the blade in and they would pound it in with a hammer. And that's how they were done. Hopefully the person's mouth wouldn't catch on fire, you know, while they were doing it. But that is how blade implants were developed. Later, they came into these type of implants, which were cylinders, where they would basically drill a hole, and also you would lightly tap it into place. Screws came later on, not too far, much later, that the screws were developed, which is the offshoot of what Dr. Brannemark originally came up with in the 60s. But even to this day, new types of implant designs are coming out. Where the heck these implants came from, I don't know. I don't know. This is not my slide. I've never seen implants like this in any catalog or any place. This is truly the Home Depot implant. This looks like a washer that they found in the aisle. There's cylinders, there's screws. I really have no idea where these implants design are. Unfortunately, since there's so many implant designs and brands, some of these weird types show up in your offices or show up in my offices. And at this point, the implants are so successful, a lot of times the crowns of the porcelain begins to fail and they need new crowns and new abutments. And then you have to find out what type of implants they have. It's almost like an archaeological dig, you know. If someone came into my office like this and needs a, you know, the crown broke or a post broke and need a new one, it's tough. So, you know, it's always a good idea to encourage your patient to keep some records on the implants that they have at home if something ever needs to be replaced. Let's look at the rest of the day. We're going to just focus on the two most common types of implant designs, which are these straight-walled screws and tapered screws, which are just down at the bottom, that come down to a taper. These are the most common type that people put in today. There's little variations of the theme, but this is what you're really going to see most of the time, is a tapered screw or a straight wall. And today, most of the implants are this internal connection point. They used to be external hex, which is like a little, almost like a little hex that sits on the top of the implant that you would connect the abutment to. But they were a little harder to match up, so this internal connection is probably the most common that we see now. It's easier for the dentist to slip the abutment into the internal part of the implant versus trying to line up this hex, which we'll see could be a problem, and we'll go into problems later on as we go along. All right, let's go a little bit more into implant basics. A lot of implants these days have a roughened surface. What do you think they have a rough surface for? It increases the surface area of the implant, and bone tends to like rough surfaces. So most implants you see these days have a rough bottom half, but have a smoother portion at the top. So a smoother portion near the soft tissue interface. Why do you think there's a smooth portion near the top? It's because of plaque. You know, what they found is that the plaque could infiltrate the implant itself or get into this roughened surface, or the old ones used to be coated with HA. You remember hearing about HA? And it would basically be contaminated and introduce bone loss. All right. Well, it decreases the bacterial attachment, and the implant becomes exposed to bacteria. So most implants are a type of screw, and also will have some rough coating on the apical end, and towards where the interface is with the soft tissue, be smoother. All right, what we've all heard the term before is osseointegration. That means where the bone actually becomes very closely adapted to the implant surface itself. That is one of the basic features or tenets of implants, is this osseointegration that occurs. The restoration is put 3 months to 6 months after the implant does integrate. We've all seen that delaying period, or period between where the implant goes in before the crown could go on. Now, there are some special circumstances where you can put a crown on the implant the same day that it's placed. This is called immediate placement and immediate load. But it's a rare situation. You have to have very good bone and good circumstances, which it's a whole day lecture to go into that, how you can put an implant in the same day, put a temporary on it. So in the most cases, the more predictable way is to put the implant in, and then 3 to 6 months later, abutment and a crown goes on the implant. All right, it's basically, once the implant goes in, it's a lot like crown and bridge. You have the implant. You have a post, or the abutment. An impression is taken, a crown is fabricated, and then you have the insertion of the crown. So once you get the implant in the right spot and well integrated, it's pretty much straightforward to get the fabrication and the insertion process of the crown itself. And we all know one of the other basic tenets of implants is that they help stabilize and sometimes eliminate removable partials and dentures altogether. So you go from a bar to a well-placed denture.